This film has been developed to help New South Wales health and community workers identify women who may be at risk of HIV, to encourage these women to have an HIV test, and if they do test positive, to provide referral information and support. In Australia, women make up 10% of people living with HIV. Since the 1980s, more than 3,000 women have tested positive to HIV, and most of these women have developed HIV through having sex with men. These women have high rates of late diagnoses, which means that the HIV has been identified many years after it's been contracted and has already had a significant impact on their body. The reason that women in Australia have tended to have late diagnoses of HIV is that neither the woman themselves or their health worker have realised they've been at risk. In your work, you can help prevent HIV transmission by raising awareness about prevention, testing and treatment. Testing and early treatment ensures that transmission from mothers to babies in Australia is almost non-existent. It also significantly reduces transmission between sexual partners. This film shows 6 women who bravely share their stories about living with HIV. Many women choose not to speak publicly about living with HIV because of concerns for family and also because of stigma and discrimination that still exists, particularly for women. 2 of the women in this film have chosen to remain anonymous for these reasons. All 6 stories speak for themselves and help raise the visibility of women living with HIV in Australia. We thank them for being so open with us.
I'm Virginia Ferner. I'm a HIV clinician and I have a particular interest in the care of women with HIV infection and also women with HIV in pregnancy. HIV stands for Human Immunodeficiency Virus, and it's a virus that has been with us now for around 35 years. It is transferred from person to person through semen, through blood, mother to child transmission. So it's a sexually transmitted virus. It's also something that people can become infected through sharing needles with injecting drug use.
In the period 1981, when it was first described, to 1996, it resulted in many deaths, and so many people considered it to be a death sentence if you were diagnosed as having HIV. It's still a very serious medical condition, but since 1996 we have effective combination treatments that can mean that most people will live a near normal or a normal life, so their survival will be the same as the general population.
The majority of women contract HIV through sex, unprotected sex, with a male partner, and usually it's their regular partner who is their greatest risk.
They make assumptions about their partners where they may not identify that they would be at risk. So, for example, they may be infected through their husband.
I'm with the Women Partners of Bisexual Men's Service. Most of the women who contact us every year are in long-term relationships with men, either heterosexual marriages or with boyfriends, and they've recently found out that their male partner is also having sex with men. Most of these women have unknowingly been at risk of sexually transmitted infections, including HIV. And in some cases, their male partner hasn't known that he's HIV positive. If you're working with a woman who believes there's a chance that her male partner may be having sex with a man or men, it's important to encourage her to test for sexually transmitted infections, including HIV, and to protect herself.
Women are not in a position often to negotiate about condom use. They don't have a power base to negotiate for using condoms in every situation. So that places them at an increased vulnerability.
My name is Mizi and I am from Somalia, and I came to Australia 1998, and that's when I was diagnosed with HIV.
My name's Diane and I'm a mother of 4 children. 3 are much older, they're in their 20s, 18 and 17, and then of the youngest one, he's 11.
I'm Michelle, I'm 44 years of age. I'm a descendant of the stolen generation, I'm from the Yorta Yorta mob down on the border of Victoria and New South Wales. I have 2 daughters, a 24-year-old girl and a 19-year-old girl.
I'm Abby, I'm 25 years old. I was diagnosed with HIV early March last year, so it's been just over 18 months now. Currently working full-time as a legal assistant in the city, planning to go back and finish my law degree next semester. Lots of good friends, healthy, fit, all of those things.
Unfortunately, it's still associated, even in our community, with stigma and discrimination and with vilification. So people who may be gay, may be thought to have HIV or known to have HIV will experience stigma and discrimination. So it hasn't gone away, even though it's been with us for 30 years.
My name is May, and I'm an overseas student. I came to Sydney to study. I was officially diagnosed last year.
My name's Emily. I live in Sydney on the Northern Beaches. I've got 2 girls. I'm single and I've been separated for about 5 years.
We have this idea in Australia that this is a gay disease, and I think because a lot of women that are positive are afraid of stigma and discrimination, they don't publicly make it known that they're positive, and so often we're not looked at as women as a person that is considered a high-risk category. Often we're wives, we're mothers, we're women with careers. The reality is we're all sexual beings.